True or false, testosterone is a male hormone. Turns out testosterone is an everyone hormone. Women have 4, 5, maybe even more, maybe 10 times the amount of testosterone naturally in their bodies than estrogen, the thought of female hormone. It has very significant, very impactful roles on a lot of the organ systems in the body. We're going to talk about that in this video, the benefits, whether testosterone therapy is right for you. Again, my name is Eric Schmidt, board certified OBGYN, minimally invasive gynecologic surgeon. Let's talk about the importance of testosterone, why it hasn't been talked about. So what is testosterone? Just like estrogen, which we talked about previously on this channel, we'll link a video here. But testosterone is a steroid hormone in the body that is impactful for a number of different reasons. It has receptors that respond to testosterone in almost every organ system in our body. And so when there is a decrease in testosterone or no testosterone, there can be significant impacts. In a woman's body, testosterone is made by the adrenal glands, also by the ovaries. This testosterone stays a little steadier than estrogen throughout the reproductive and beyond years. Testosterone peaks in someone's 20s, steadily declines starting in the 30s, and is about 50% of its peak when someone is going through menopause. And so that can have some pretty significant symptoms that we'll talk about here in a second. And why hasn't this been discussed with most all patients? Well, we'll get into that too. Let's talk about the big benefits when it comes to testosterone. Testosterone plays a big role in someone's libido or sexual desire. And so when someone is going through their menstrual cycle in their menstrual years, it's that testosterone that often is associated with that increased libido around ovulation. So as testosterone potentially decreases in the years following, that can have significant impacts. That loss of sexual desire can be quite distressing to someone's life. Also benefits, other parts of the mood can be severely impacted by low testosterone. It helps with energy levels. It helps with muscle mass. And we know how important that is for longevity and bone density. And also something very important would be cognition. The brain has so many different testosterone receptors there that if that testosterone goes away, it can have severe impacts. Some people, when they start testosterone therapy, they notice they're getting a lot of their the thought process, the brain fog is gone. They're remembering things they forgot about. And so it has huge benefits when it comes to cognition. Also, they think that might be beneficial for the cardiovascular system. It thought in the past that maybe it was a risk factor for disease of the cardiovascular system, might actually be protective. Same thing with breast cancer, might actually be protective of the breast tissue. So why isn't testosterone and the benefits talked about more? Why haven't you heard about this before? I mean, most recently, it's getting a lot of light on social media, but why is there this lag? Well, early 2000, we talked about it before, there was a WHI study which shed a lot of poor information on the treatment of people with perimenopause, low hormone symptoms. And so it said that things like estrogen, progesterone had increased risks of things like breast cancer, strokes, things like that. Scared all providers away from using hormones basically overnight. And the people that were in training, like myself, in the years and decades to follow, basically weren't taught much about hormones because we were basically taught they were bad because of this study. And so only a very select, perfect, healthy patient would maybe get hormones. And so unfortunately, it took a lot of experts and reinterpretation of the study and the data, which is just coming to light, and people are becoming more and more comfortable with prescribing hormones. A lot of this has kind of fallen on the OBGYNs for doing this. However, it's my belief that almost all specialties should be comfortable in using hormones and how big of a benefit they have. For example, if someone's in their mid-40s, they're having these mood symptoms and they don't know why, they're just feeling terrible, depressed, things like that. Their doctor puts them on SSRI, which is antidepressant medication, which, maybe helps a little bit, maybe, but also has significant side effects like decreased libido. We'll talk about that more in a bit. But that can further worsen the potential issue when in fact, maybe just safe prescription of hormone therapy is the right answer. Also, back before that study and what they used before the study were synthetic hormones. We're using more bioidentical hormones, which the body is able to process easier and aren't as potent. And so that is one other thing that is a big factor in these potential risks that were brought up by the study. This is why it's important to seek out providers that are versed in prescribing hormones and know their safety, know the potential risks, and will have the conversations with you and not just dismiss you and your symptoms as a part of aging or a part of being a woman. And so if you do get that answer, always get a second opinion, because there's really only a couple issues which we really don't prescribe some of the hormones for. Again, at the end of the video, I'll give you my recommendation for how to seek out somebody that is very good at prescribing hormone therapy. Another big issue, especially here in the United States, is that there are zero FDA-approved prescription options for testosterone replacement. There is one in Australia, but here in the United States, we've had to get more creative with prescribing testosterone. And this is another barrier, which, again, for some providers, they don't have an option. They're hesitant, and they might be inclined to say no to prescriptions for this because they just aren't comfortable with going through a compounding pharmacy or using a male product. As always, it's important to discuss potential risks when it comes to prescribing a medication, not just hormonal medications. And the question is, well, if testosterone hasn't been around that long, like, does it actually have good safety data? It actually does. Testosterone has been used in high doses in women for years, for decades, actually. And this is in transgender men. They were given male physiologic level hormone replacement for decades, and they were able to observe, see if there was any increased risk of things like the cardiovascular disease, cancers, other things, blood clots, and overall the safety data proved it very safe. And for a woman looking for testosterone therapy, they would only be at 1/10 of that dose. So you can pretty easily conclude at 1/10 of the dose, it generally would be very safe. As I mentioned before, one of the risks that was thought to be due to testosterone was that it might increase your risk of cardiovascular disease. And there was a couple of thoughts behind this. One, we know that women, when they go through menopause, estrogen decreases and their ratio of testosterone to estrogen increases a little bit, that maybe that's because of the testosterone. Actually, that's untrue. Testosterone is no longer listed as a risk factor for cardiovascular disease. It might actually be protective for the cardiovascular system. But potential side effects of testosterone therapy would be things like hair growth. Testosterone does promote hair growth in a lot of different areas of the body. People would describe these as male pattern hair growth. It also can cause hair loss. Again, more of a male pattern hair loss with higher testosterone levels. This is why when someone's given a testosterone cream or gel, generally they place it in an area where they maybe would less mind if they had an increased density of hair follicles. Things like the male pattern hair loss would be seen more with supra or elevated levels of testosterone that may be too high for that individual patient. May also cause acne or oily skin. Again, this is usually temporary, usually minor, or if it's really bad, it might just be too high of a level for that individual patient. Again, more rare, but these are some of the more common side effects for this therapy. Going even more rare, can cause things like voice deepening, can cause things like clitoromegaly or increased size of the clitoris, or mood changes or mood instability. Again, these are very supratherapeutic or if someone has these, generally they have way higher level of testosterone, or they're given too much testosterone. And a lot of the experts never even see these symptoms, but we talk about it, we list them, because it potentially could happen if someone's given too high of a dose. Often a big question I get is, well, how do we monitor this? Again, it's kind of new. There's not a perfect way to monitor. There's kind of some generally accepted ways to monitor, but there's no perfect way. If somebody's using transdermal, and we'll talk about the different ways that we can use testosterone therapy, but if someone's using transdermal, the impact on the things like the lipids, the liver, is minimal to none. But someone might want to check baseline liver levels, baseline lipids, just because there is this old thought that it may affect that. Often we might want to check a free testosterone level, maybe also a total testosterone level, as well as often people do a sex hormone binding globulin if someone wants to get a baseline prior to starting the therapy. The sex hormone binding globulin is a hormone that's created in our body that binds up the free testosterone or estrogen and makes it so that it can't be used, and so it doesn't have effect. So if someone has a higher level of the sex hormone binding globulin, they may not respond to the normal dose as someone else would. They may need higher doses, something that we also look at. And then going forward, we may monitor levels every 3 months as we were initially starting, and then maybe extend 6 months, maybe a year when someone is stable on their dose. When it comes to monitoring or very special expensive labs, you don't need that for this. We're often treating to the symptoms. And so if somebody has significant hypoactive sexual desire disorder or low libido, we're treating to that symptom, just giving them enough of the testosterone to make these symptoms better. We're not exactly shooting for a perfect exact number. Again, if the low normal for a male testosterone level in the early morning is like 300, then so the thought would be for a woman, 1/10 of that level would be 30. We're not shooting for an exact number, but more of an improvement of symptoms. We might use these lab tests to help guide us, but they're not going to completely dictate your therapy. I think if people are doing in different practices are doing a lot of labs and it costs you a lot of money and they're doing it through their own clinic, I don't know that that's exactly needed. They might just be an expensive test that you may not need. Now, all these tests should be fairly inexpensive. There shouldn't be any exorbitant, super sensitive testosterone tests if they're advertising that at your clinic. I don't know how beneficial that is. Or if someone's trying to titrate your levels to a specific number, I don't know how beneficial that is. Again, we're trying to make the symptom better and not exactly treat a number per se. And so what I recommend is just going through the normal lab companies, getting the tests that are covered potentially by insurance, and therefore minimal out of pocket, minimal chance that you're getting scammed. All right, fun and important part. How do we give testosterone therapy? And there's a number of different ways. Often the best way to give a medication like this is transdermally, so it's absorbed through the skin. This would often be like a cream, gel, maybe even patch. However, in the United States, once again, we have no FDA-approved ways of giving this medication. And for whatever someone thinks about the FDA, when you have an FDA-approved medication, it's very consistent. And so that's what's nice about having those medications. But we can still use these medications that are made for men that are FDA approved. These would be medications like Androgel or Testim, which come in little packets that almost look like a little travel toothpaste. One dose of that is a daily dose for a male. And so what you would do is squeeze out 1/10, which generally is kind of like a pea-sized amount, and rub that on usually the inner thigh or back of the leg, or on the arms here. Again, just trying to be sensitive where you might have a potential increased hair growth and where you might want that. But that's one of the best ways to do it, in my opinion, because it's going to be a very consistent, approved, rigorously tested medication. While it was originally made for men, at 1/10 of the dose, it's been proven to be very safe for women. Now, if anyone's taking a trip to Australia in the near future, you could stock up on Androfem. It is a approved medication through Australia that they have there and available. But unfortunately, we don't have that here in the US. And so a lot of people rely on compounding pharmacies. Now, there's a lot of great compounding pharmacies out there. And generally, if you have a menopause provider, they have a pretty good relationship with a local compounding pharmacy where they're able to mix up these medications and give it to you that way. However, there can be some variation with this. Again, it's not as rigorously tested. So there's a slight amount of variation, but if your doctor really trusts a compounding pharmacy in your neighborhood, I would go with that. Again, aiming for the physiologic dose of a woman, not anything significantly higher. There are also injections and pellets, which generally these aren't as recommended. If someone has an ill side effect, you really can't take them back. And so pellets, while a lot of people really swear by their pellets and they've helped a lot of people, we don't necessarily recommend them because we've definitely seen a fair amount of people come to our offices that have had pellets placed and they last for 3 to 6 months. And so if someone is having a super therapeutic dose and symptoms, we talked about it, hair growth in places you don't want it, hair loss in places you want it, or deepening of voice, clitoromegaly, like we talked about all these issues that can happen from super pure therapeutic doses. And a lot of times when we see those symptoms, it's from the pellets. And so, but again, a lot of people like their pellets. So after all this, should you consider testosterone replacement? And for sure, again, the most studied, well-documented group to do testosterone replacement would be in postmenopausal women who have low libido or hypoactive sexual desire disorder. It's well studied in this population, and it is for sure a reason to prescribe. However, yes, it can be used in premenopausal women. There's just this initial hesitancy due to the potential thought of pregnancy and things like that, and so it wasn't studied in this group, but it is proven to be very safe for low libido, but also for other changes. We talked about the mood changes, cognition changes that can come. And so if you're working with your provider, again, find somebody that is well-versed in hormone therapy. They can walk you through estrogen, progesterone, testosterone, find out which one's going to best treat your symptoms, make it so you don't have to worry about these symptoms in your everyday life. If you're wanting to find a hormone provider that is well-versed in this area, I recommend going to two different websites. There is the North American Menopause Society, or what we call NAMS. They offer an additional certification or test to for providers that are interested in this field, and conferences and things like that. So you know if your provider is certified in NAMS, they will likely be very versed and comfortable with hormone replacement. And so I would check that website out. There's also the ISHWISH, which is the International Society of Study of Sexual Health, which is another great website that has a lot of providers that are well versed in sexual health, hormone replacement therapy, or hormone therapy. So those are two websites I would check out if you're looking for a provider in your area. Testosterone therapy isn't for everyone. However, it can be life-changing for a lot of people who are suffering from low testosterone symptoms. And it's not just all about sex, it's about energy, identity, confidence. Find a provider near you who's comfortable with prescribing it. And just like any hormone therapy, there should be less barriers to you getting these treatments, as they are proven safe and can help significantly. I hope you all enjoyed this video. Little button down there that says like if you don't mind, subscribe if you want to. We'll talk to you soon in the near future with our next video.